Good day, everybody. Yeah, I want to talk about the health benefits of K2, vitamin K2, and where vitamin K2 can be found in terms of foods, and also supplements, and then some benefits, some health benefits of vitamin K2. Yeah, the reason I want to talk about this because just the other day, um, I went and purchased a vitamin K2 supplement based on some things I learned on YouTube. So something from um, doctor on YouTube and some other people on YouTube, and so I kind of I heard about vitamin K2 from some people on YouTube, and I was interested. I mean, kind of made me interested in possibly giving it a try, and so sure enough, I found a good deal. I think the best deal I found was at Hy-Vee supermarket. I get 90 capsules of vitamin K2, 100 micrograms. I think it was like $7.99 or $7.79, something like that. It was somewhere in there, that was the best price I found. Better than some other stores that I looked at, so anyway, and then I tried it. And I was like, this is kind of like, yeah, I kind of felt like a little bit more calm. I kind of felt like, just kind of maybe like a little bit less anxiety and maybe like slightly improved mood. And so I thought I'd talk about that a little bit. Like there's some things that you can't really you can't really gauge on your own. Like there's some cardio, like the main reason I want to try that is because like for cardiovascular benefits and like that were kind of you know, um, decreased calcification in the cardiovascular system. Not sure if that's the best way to describe that, but that's kind of what sold me. Um, so anyway, so I'm on this website. I found several different things that. Um, this is Dr. Stephen Lin. I guess this is Dr. Stephen Lin there, and yes, vitamin K2 is crucial for your heart, bones, and brain and teeth. Need I go on? Dental nutrition is the only way to eat for life-changing health. Vitamin K2 for youthful skin, fertility, and preventing cancer. As we've discussed in this series, the benefits of vitamin K2 begin from inside your teeth, right through to your gums, heart, and bones. What's good for our teeth is good for our whole body. That's why our teeth are a great barometer for our whole body health. So it's not surprising that vitamin K2 has benefits all over the body. I don't think I'm going to play this video yet, but I do want to kind of go over some of the things that this person discusses. So we'll explore research into how vitamin K2 can boost your general health, beauty, and even longevity. Maxtrix GLA protein, MGP, and osteocalcin. Vitamin K2 activates two key proteins in the body. Osteocalcin, once activated, it carries calcium and minerals into bones and teeth. It's mostly responsible for the dental health and osteoporosis prevention based benefits of vitamin. Matrix GLA. The non-bone and teeth benefits of vitamin K2 are mainly tied to the action of the matrix GLA protein. This protein is activated only in the presence of vitamin K2. This process is called carboxylation. Non-carboxylated matrix GLA protein, which is known to form as a result of vitamin K deficiency, is associated with cardiovascular disease, is known to have actions in the kidney and lungs too. Vitamin K2 benefits that will improve your health. And so this doctor listed 9 different benefits. Number 1, vitamin K2 may prevent wrinkles and reverse aging. Collagen and elastin are 2 of the components of skin that give it firmness and elasticity. As skin ages, it loses both collagen and elastin, and its youthful appearance along with them. Skin cells appear to release matrix GLA protein to prevent calcification of elastin in the skin. One study looked at a genetic disorder where premature aging occurs. It found that elastin is calcified due to the lack of vitamin K2 activated matrix GLA protein. Vitamin K2 could help maintain youthful skin, activating matrix GLA, and in turn preventing calcification of elastin. Non-K2 pseudoxanthoma elasticum, a condition where the mineralization of skin and premature wrinkles occur. Number 2, vitamin K2 to prevent varicose veins. Vitamin K2 activates matrix GLA protein to mop up calcium in the vessels. Cardiovascular benefits. Calcification of veins has been shown to be a contributor to varicose veins, so vitamin K2 may also prevent varicose veins. Varicose veins are not always detrimental to our health, but can be unsightly and uncomfortable. Number 3, vitamin K2 for blood sugar regulation and type 2 diabetes. The second vitamin K dependent protein, osteocalcin, may help the body to use insulin. Activated proteins may increase insulin sensitivity, the core problem in type 2 diabetes. It should be noted that evidence in this area is conflicting, though. One meta-analysis on this topic showed no effect. Number 4, vitamin K2 to increase exercise performance. Bones release osteocalcin during exercise, seemingly sending out messages to help muscles cope with increased energy demands. Vitamin K2 protein allows skeletal muscles to use energy during exercise, increasing the efficiency of the workout and potential performance. Number 5, vitamin K2 and polycystic ovary syndrome, PCOS, female fertility. Polycystic ovary syndrome is characterized by an overproduction of certain steroids, such as testosterone and DHEA sulfate. One randomized clinical controlled trial showed that vitamin D-K-calcium co-supplementation for 8 weeks among vitamin D deficient women with PCOS decreased DHEAS levels and testosterone levels. Vitamin K2 and its role in hormone production could both prevent and help treat polycystic ovary syndrome. Number 6, vitamin K2 for low testosterone in male fertility. Vitamin K2 MK-4 is used for steroid production in the male testes. Studies in rats have shown that a diet providing MK-4, 75 milligrams per kilogram, enhanced testosterone levels compared to the control. Number 7, vitamin K2 for preventing kidney stones. People with chronic kidney disease and those receiving dialysis are at risk of vitamin K deficiency. One risk factor for kidney stones is excess vitamin D, as demonstrated in lifeguards. But the real problem is that vitamin D creates a need for vitamin K2. Patients with kidney stones secrete matrix GLA protein in its inactive form. Vitamin K2 deficiency is a major cause of kidney stones. People with polymorphisms for matrix GLA protein also have higher risk of kidney stones. Number 8, vitamin K2 to prevent cancer. Prostate calcification appears to be a significant factor in the development of prostate cancer. One study on vitamin K2 indicated that it can reduce the risk of prostate cancer by 63%. In liver cancer, vitamin K2 supplementation has been shown to help reduce recurrence and delay progression. And number 9, vitamin K2 in the brain. The most obvious role of vitamin K2 on the brain may be prevention of cardiac embolism or stroke. Matrix GLA protein has a role in preventing stroke due to its cardiovascular benefits. However, recently, vitamin K2 dependent proteins have been shown to play a key role in the brain and central and peripheral nervous systems. They may even have an antioxidant role in the brain itself. Specifically, vitamin K2 alongside K1 seem to act with glutathione to prevent death of nerve cells and brain damage. Its role could be key in the neurodegenerative process. Overall, it seems to prevent oxidative stress and inflammation in the brain. Early studies are also showing that lower intake of vitamin K relates to Alzheimer's disease. Overall, it seems a good dietary intake of vitamin K2 is vital for optimal brain function and preventing degenerative diseases. So then we'll go over, and this is from Cleveland Clinic. These 11 foods are high in vitamin K2, but that doesn't mean they're all healthy. And it kind of suggests a lot of greens and a lot of some of these, like, like, I don't get a lot of vitamin K2. I don't get a lot of K2 based on what they say. Like, I like salad, but I don't eat a lot of, like, I don't really know what collard greens. I don't like spinach. I don't like broccoli. I do like Brussels sprouts, but I don't think I get a lot of vitamin K2 in my diet. Or this is K1, but this is I don't eat a lot of those. I like salad, and there's various things in the salad. Um, so then it lists healthy sources of vitamin K2. The first one is natto, fermented soy. I'm not real familiar with that Japanese dish. Next one is chicken breast. Who doesn't like chicken? Sauerkraut, fermented milk. Moderately healthy choices for vitamin K2. So this site breaks them down into like healthy, moderately healthy, and less healthy, and then rarely eat those. So moderately healthy choices for vitamin K2. Gouda, I don't know how to say it. It's kind of a cheese. Blue cheese, egg yolks, chicken liver, and then these foods you eat rarely. First one is butter, or suggest you eat these rarely. Salami and ground beef. So I don't eat really any of those very frequently. I eat chicken fairly frequently, but that's all on that list. So maybe that's why the supplements seem to help me a bit. I don't know. Maybe I was deficient in that part of the things I eat. But anyway, so I like I was looking at the some of these studies, and this is not observation. This is from PubMed, observational study from JAM Heart Association 2021, published August 7th, 2021, or August 17th. Vitamin K intake and atherosclerotic cardiovascular disease in the Danish diet, cancer, and health study. And I'll just read the abstract because it's got some helpful information. Background dietary vitamin K, K1 and K2 may reduce atherosclerotic cardiovascular disease, ASCVD, risk via several mechanisms. However, studies linking vitamin K intake with incident ASCVD are limited. We aim to determine the relationship between dietary vitamin K intake and ASCVD hospitalizations. Methods and results in this prospective cohort study. Participants from the Danish diet, cancer, and health study with no prior ASCVD completed a food frequency questionnaire at baseline and were followed up for hospital admissions of ASCVD, ischemic heart disease, ischemic stroke, or peripheral artery disease. Intakes of vitamin K1 and vitamin K2 were estimated from the food frequency questionnaire, and their relationship with ASCVD hospitalizations was determined using Cox proportional hazards models. Among 53,372 Danish citizens with a median age of 56 years, 8,726 individuals were hospitalized for any ASCVD during 21 years of follow-up. Compared with participants with the lowest vitamin K1 intakes, participants with the highest intakes had a 21% lower risk of an ASCVD-related hospitalization after multivariable adjustments for relevant demographic covariates. Likewise, for vitamin K2, the risk of an ASCVD-related hospitalization for participants with the highest intakes was 14% lower than participants with the lowest vitamin K2 intake. Conclusions: risk of ASCVD was inversely associated with diets high in vitamin K1 or K2. The similar inverse associations with both vitamin K1 and K2, despite very different dietary sources, highlight the potential importance of vitamin K for ASCVD prevention. So, according to this study, both vitamin K1 and K2 reduce atherosclerotic cardiovascular disease, at least in terms of like hospitalization for that. And it looks like in the study, the K1, the people that are higher in K1 that ate more foods with vitamin K1 had a 21% lower risk of ASVD-related hospitalization. And with vitamin K2, the people had that were in the higher group in terms of intakes of vitamin K2. They had 14% lower than participants with the lowest vitamin K2 intake. So there were less hospitalizations in both the K1 and K2 group that took more vitamin K1 and K2, according to that study. Then we looked at so it's hard to it's kind of, you can't really feel like you have less calcification in your blood vessels. Like you kind of but you can feel like if it helps cognition and brain health. So I kind of noticed improvement in slight improvement in mood, slight improvement in anxiety, and slight improvement in just feeling more calm altogether. Just kind of less volatility in terms of mood, and just kind of feel more calm. And I noticed that, and so I'll probably continue that message just for that reason alone, and slight improvement in mood, and if it has these cardiovascular benefits, there's some good reason to keep taking it. I haven't noticed any side effects, at least not yet. And so, or at least nothing obvious. But anyway, this is another study here, and this was in 2024, published January 2025. Maybe they finished the study in 2024, but anyway, the title is the role of vitamin K2 in cognitive impairment, linking vascular health to brain health. And I'll read the abstract. The abstract is cognitive impairment marked by a decline in essential mental aspects such as attention, memory, and problem solving is significantly correlated with advancing age. This condition presents a major challenge for the elderly, adversely affecting quality of life, diminishing independence, and imposing substantial burdens on healthcare systems. Recent research indicates that vitamin K2 may be vital for preserving brain health and cognitive function. Traditionally recognized primarily for its role in blood coagulation, vitamin K has emerged in recent years as a nutrient with diverse biological effects essential for healthy aging. A growing body of evidence from both observational and interventional studies underscores the pivotal role of vitamin K2 in mitigating arterial calcification. This mechanism may link vascular health to cognitive function, suggesting that vitamin K2 could play a critical role in the prevention of cognitive impairment in aging populations. So, that just kind of goes to show that my initial impressions of taking the supplement were that maybe there was something I was slightly lacking in my diet I'm not elderly, but I think it just kind of helped my just help slightly slight improvement with mood and slight improvement with cognition. So slight improvement with anxiety. So to me it's worth talking about. Worth mentioning. Let's see if I can get to this next one here. And then this one here is from 2021, August 2021. Title is Growing Evidence of a Proven Mechanism Shows Vitamin 2 Can Impact Health Conditions Beyond Bone and Cardiovascular. And I'll read a little bit. This is just kind of get, you can understand what, people are interested in the health effects beyond just, bone health and cardiovascular, because that's what it says on the, on the bottle. It says strong bones and cardiovascular support. So anyway, vitamin K2 is a vital nutrient newly recognized for supporting bone and cardiovascular health, shown in observational and interventional trials in healthy and patient populations in adults and children. Even more recently, it has come to light that K2 status and the vitamin's mechanism of action impact other health areas, including but not limited to brain health, healthy joints, neuropathy, and vision health. This evidence lends itself to the argument that correcting a widespread vitamin K2 deficiency can significantly improve global health. The first step is remedying that deficiency, is establishing a vitamin K2 specific recommended daily intake. So I talked a little bit about the cardiovascular health. I may not go into like a whole lot more detail on that. Like arterial calcification is what gets focused on. Is considered an unfortunate result of aging, but fortunately we can actively regulate this process by providing our body with adequate amounts of vitamin K2. This nutrient is essential to activate the most potent modulator of vascular calcification matrix GLA protein, MGP, and thus lower the risk of age-related cardiovascular decline. So there's a study. They described a study that looked at it shows when taken daily in nutritional doses, 180 micrograms for 3 years by a healthy population, vitamin K2, MK-7 improves cardiovascular health. Substantial benefits in inhibiting age-related stiffening of arteries, resulting in increased pulse wave velocity, PWV, in the placebo group, but not in the MK7 group. Most remarkably, MK7 not only suppressed arterial stiffening, but also resulted in an unprecedented, statistically significant improvement of vascular elasticity, both measured with ultrasound techniques and PWV in a healthy population. So these studies kind of focused on significant decrease in to maintain arterial flexibility, and the stiffness did not increase. So placebo group in this study, people had increasing stiffness and less flexible arteries, arterial flexibility with age, and less an improvement with vitamin K2 supplementation. So then we'll look at look at brain health. Vitamin K2 and MK7 is unique because it impacts arterial calcification, and no other compound has been shown to do this. It turned out that this nutrient also lends a vital cardiovascular support to patients with chronic kidney disease who are on dialysis and renal transplant recipients. So explored for impact for brain health. Vitamin K, a fat-soluble nutrient, was historically discovered in 1935 for its role in blood coagulation, and as such has been thoroughly explored. In recent years, studies highlighted vitamin K2 involvement in brain cells development and survival. In the brain, vitamin K occurs predominantly as MK-4. Vitamin K2 has been involved in functions such as cell survival, chemotaxis, mitogenesis, cell growth, and myelinization, mediated by the activation of vitamin K-dependent proteins. Growth arrests specific gene 6, GAS6, and protein S. Moreover, vitamin K2 is also involved in the synthesis of sphingolipids, an important class of lipids present in high concentrations in brain cell membranes. Initially appreciated for their role in essential structural components of cell membranes, sphingolipids are now known to participate in important cellular events such as signaling, proliferation, differentiation, senescence, transformation, and survival of brain cells. In recent years, studies have linked alterations in sphingolipid metabolism to age-related cognitive decline and neurodegenerative disorders such as Alzheimer's and Parkinson's disease. So they're looking at, in terms of Alzheimer's disease and other forms of dementia as well, and and also Parkinson's disease, multiple sclerosis. There's kind of possible treatments for these things, and also migraines. It can also be a potential treatment for migraines, also peripheral neuropathy. And then the last portion is, like RDI, I guess that's recommended reference daily intake. So there's different, so some of these things that this article talks about, peripheral neuropathy are, things that people are studying and finding benefits for migraines, multiple sclerosis, Parkinson's disease, Alzheimer's disease, and other forms of dementia. So there's that. And then, so this is another article that I found that, surprising connection between vitamin K2 and improved mood and mental health. Just for the sake of time, I don't think I'm going to read all this, but this is from allaboutVitaminK2.com. And it's also fairly, like a lot of, vitamin K2 is becoming more popular, and you can kind of see why, it's got some good effects on the human body. The brain-bone connection, the link between vitamin K2 and mental health may seem surprising, but it actually makes sense when we consider the connection between the brain and bones. But the brain and bones are major consumers of calcium, and they rely on a delicate balance of this mineral to function properly. When there is too much calcium in the body, it can lead to calcification, which is the buildup of calcium in soft tissues. This can be harmful to organs like the heart and kidneys, but it can also affect the brain. Studies have shown that calcification in the brain is associated with cognitive decline and increase in risk of dementia. On the other hand, there's not enough calcium in the body. It can lead to weakened bones and increased risk of osteoporosis. This is where vitamin K2 comes in. By activating proteins that help regulate calcium levels, vitamin K2 ensures that calcium is being used properly in both the brain and bones. Vitamin K2 and mood. While most of the research on vitamin K2 has focused on its role in bone health, there is emerging evidence that this nutrient may also have an impact on mood and mental health. One study published in the Journal of Nutrients found that higher levels of vitamin K2 were associated with a lower risk of depression in older adults. Another study published in the Journal of Affective Disorders found that vitamin K2 supplementation improved symptoms of anxiety and depression in patients with Parkinson's disease. This is significant because Parkinson's disease is associated with a higher risk of mood disorders. So how exactly does vitamin K2 impact mood? One theory is that it may have anti-inflammatory effects on the brain. Chronic inflammation has been linked to depression and other mental health disorders, and vitamin K2 has been shown to have anti-inflammatory properties. And I'll read this one. Vitamin K2 and cognitive function. In addition to its potential benefits for mood, vitamin K2 may also play a role in cognitive function. A study published in the Journal of Nutrition, Health and Aging found that higher levels of vitamin K2 were associated with better cognitive performance in older adults. Another study published in the Journal of Alzheimer's Disease found that vitamin K2 supplementation improved memory and executive function in patients with Alzheimer's disease. This is significant because Alzheimer's disease is characterized by cognitive decline and memory loss. One possible explanation for these findings is that vitamin K2 helps protect against brain calcification, which can impair cognitive function. By regulating calcium levels, vitamin K2 may help prevent the buildup of calcium in the brain and preserve cognitive function. The importance of vitamin K2 for mental health. While more research is needed to fully understand the link between vitamin K2 and mental health, the existing evidence is promising. As an expert in nutrition, I believe that vitamin K2, this is the author, an important nutrient for overall health, and its potential benefits for mood and cognitive function should not be overlooked. However, it's important to note that vitamin K2 is not a magic cure for all mental health disorders. It should be used as a part of a comprehensive treatment plan that includes a healthy diet, exercise, and other lifestyle factors. So yeah, it can be helpful, but it's not, not cure-all. And then lastly, this one I look at from Tufts now, Tufts University. New research deepens understanding of how vitamin K affects brain health. A paper from Human Nutrition Research Center on Aging identifies potential mechanisms by which vitamin K affects the brain as people age. And this one's interesting because it talks about insufficient consumption of vitamin K may adversely affect cognition as people get older. The study conducted in middle-aged rodents suggests that a lack of vitamin K may increase inflammation and hamper proliferation of neural cells in the hippocampus, a portion of the brain that is capable of generating new cells and is central to functions such as learning and memory. Vitamin K, so lower levels of vitamin K means less neurogenesis in the hippocampus, and more higher levels of vitamin K at least seems to be associated with higher levels of neurogenesis in the hippocampus, which is then the hippocampus is associated with learning and memory, and it probably also has a role in mood and anxiety as well. But vitamin K is found in green leafy vegetables such as Brussels sprouts, broccoli, green peas, kale, and spinach. It is already known to play an essential role in blood clotting, and research suggests it may also have positive effects on cardiovascular health as well as joint health. There's also research that indicates vitamin K contributes to brain function, and that brain function declines during the aging process. Vitamin K seems to have a protective effect. Our research is trying to understand the underlying mechanism that for that effect, so that we might one day be able to target those mechanisms specifically. Learning and memory affected. 6-month dietary intervention. Yeah, so they did a test that deficiency is associated with noticeable cognitive decline as measured in a series of behavioral tests designed to assess their learning and memory. And then there was a novel object recognition test. The vitamin K deficient mice showed a diminished ability to distinguish between familiar and new objects, a clear indication of impaired memory. And a second test to measure spatial learning. The mice were tasked with learning the location of a hidden platform in a pool of water. The vitamin K deficient mice took considerably longer to learn the task compared to their counterparts with adequate vitamin K levels. So they've also found significant changes within the hippocampus, the brain region for learning memory. Specifically, they observed a reduced number of proliferating cells in the dentate gyrus, the hippocampus, and the vitamin K deficient mice. This decrease translated to fewer newly generated immature neurons, a process known as neurogenesis. And then you also found a higher number of activated microglia, which are the major immune cells in the brain, presumably with the higher level of vitamin K, K2 intake, vitamin K intake. So anyway, and then obviously if there's higher neurogenesis in the hippocampus, if you ask artificial intelligence, what does the hippocampus do? And the hippocampus is the brain's memory engine, the structure that lets you form new memories, understand where you are in space, and connect experiences with emotions. More precisely, it's responsible for learning, short and long-term memory formation, spatial navigation, and linking memories to emotional meaning. So core functions of the hippocampus: forming new memories, memory consolidation during sleep, spatial navigation, and emotional context and social memory. So yeah, if you're getting more neurogenesis, through vitamin K supplementation in the hippocampus, then you're going to get, you'll be able to learn more quickly. You have better memory consolidation during sleep, at least presumably. You might have better memory consolidation during sleep. You might have better spatial navigation, and you might have a better emotional context and social memory. So yeah, there's a lot of different things that vitamin K2. Like I wasn't really aware about. I kind of I hadn't tried vitamin K2 before this past week, and I was kind of like I heard about it, but I hadn't I was interested in trying that because of the main reason I wanted to try is because I've heard improve cardiovascular health, but I think it can improve other things as well. It can improve brain health. Apparently, it can increase testosterone. Like there's prevent cancer. Like I mean I'm not gonna try to sell it as like the greatest thing ever, but it's I think it's not a bad thing. It's kind of like I mean like there's some things that you have to do tests in order to do like learn more about your cardiovascular health, but like a lot of like if you notice like a slight improvement in like brain health, memory, and mood and anxiety, like it's not a bad thing. So like anyway, I think I'm gonna keep going with it for now. Like I said, it's like $7.99 or $7.79 at the supermarket, and I think it's a good deal. I've kind of gone with like one in the morning, one in the evening, and yeah, I think it's worth it. I think it's a something that's helpful. If there's like a less emotional volatility and like I was just thinking that the things that I thought of. I just like I haven't noticed like huge improvement in learning, but you just kind of feel calmer. Feel a little bit better. Like yeah, like there's it seems like they have like both cardiovascular and brain health benefits. So sometimes it's easier to notice the brain health benefits. But yeah, anyway, yeah, not a whole lot of side effects. So I'm happy with them. I think I'm gonna keep trying that for now. And yeah, it's probably time for me to be quiet and do something different. Anyway, hope you are enjoying your day, and till next time, have a good day.